Alright, so there's a lot of things going on in our shoulders, and today we're going to talk about what happens with acute injuries, some of the things that I look for to make sure it's not too bad, and some of the things that I look for to see how far we're going to progress in the early stages. So, one of my first questions is, of course, how bad is it? So, the first red flags for me, assuming that we've ruled out any broken bones from a fall or anything that seems like it looks like it could be a fracture, I'm looking to see is if you have what's called a positive drop arm test, which means when you try to raise your arm up, if your shoulder starts to try and do more of the work as the arm itself drops. At the same time, some people will feel sharp catching if they make big circular movements backwards or forwards. And in either case, one of the first things I'm going to do is refer to an orthopedist. While these tests are not necessarily signs that you must have surgery, they do indicate that it could be a possibility, and that's one that I never want to rule out on my own. So I'll usually have a surgeon take a look and see what their thought is. Right off the bat, if either of these two signs is part of your condition, it's always worth checking to make sure that nothing serious is sitting there for too long. More commonly, what we're going to see is muscle and tendon strains, which is our very nice way of saying small tears. These usually present in a pretty straightforward manner. Active lifting and loading, which means if you apply a small amount of weight in certain planes, such as reaching straight forward with either your palm up or your thumb down, or if we're trying to push into our belly or resist motion going out to the side. You'll usually find these are aggravating, and sometimes they're also weaker than the other side. Reaching up overhead and stretching behind our backs, either up forward, out to the side, scratching your back this way or this way, may present with a pulling feeling, especially at the end range. The combination of these two symptoms and some definite tenderness along some of the muscular regions of your shoulder is usually a sign of a sprain or strain in the shoulder itself. A similar issue may still present if you have all of these signs, but also notice that you have an increase in pain if you reach across your body or if reaching down straight ahead of you. This is known as impingement syndrome, but both symptoms, either if we're just dealing with muscles or if we're dealing with impingement itself, are treated relatively similarly. Our goal is to do gentle exercises, trying to do some light stretching in the directions that are painful to pull into, trying to keep the pain-free range of motion that you have, as well as trying to increase your loading through different exercises that go through the different planes that are painful, whether it's thumb down, palm up, inside or outside, using light weights or elastic bands. As we slowly progress into greater and greater resistance levels, we want to do this at a rate that doesn't exceed the amount of pain you're having. Over this early period of time, ice is usually your friend, especially over the first week or two. But afterwards you might notice that heat seems to provide a little bit more relief. Regardless of the severity of what you perceive, if you're unsure about your symptoms or they don't appear to be resolving at the rate you expect, your doctors and therapists are always here to help. So feel free to stop by with any questions anytime something like this crops up. And it's okay to not be absolutely sure what's going on, because part of our job, of course, is to help you find out. Have a great day.